Good morning, Queensland. We've had another morning of very encouraging news as we battle the Indooroopilly Delta outbreak. We're reporting 13 new cases in the last 24 hours. All are linked to that outbreak. 12 were not infectious in the community, and the 13th we're just continuing to get details from. Of those 13, 2 cases are household contacts of a known case at the Indooroopilly karate class. 1 is a close contact from the karate class. 5 cases are household contacts of Ironside State School cases. 4 cases are household contacts of Indooroopilly State High School cases. 1 is a close contact of a known case at Brisbane Boys Grammar School. So the total number of cases in the Indooroopilly Delta cluster is now 102. We've had 1,909 cases in Queensland since the pandemic began, and 144 of those are active. We did 40,835 tests in the last 24 hours. So across the metrics that we are looking to, good results. All cases are linked, limited community exposure, and a continued high testing rate above that 40,000 goal that we set for ourselves. It's important to note we will see continued cases. Many people in households with a case will continue to catch the virus in coming days and weeks. What's most important is that they are not outside of their household, that they are not infectious in the community. There are 10,091 people subject to home quarantine directions right now. So that's the cohort that we are monitoring. Whatever happens tomorrow, those 10,091 people will need to stay in quarantine. Depending on their circumstances, that could be for some time. Our supermarkets continue to report high demand for grocery deliveries, particularly in those inner western suburbs of Indooroopilly, Taringa, St Lucia and Toowong. That's in part because of the sheer number of people in quarantine in those suburbs, but also because hundreds of their own staff are also in quarantine. They've opened up additional priority delivery slots, redeployed staff where possible, and brought in additional delivery trucks. But the wait for deliveries in those areas continues to be in the range of 2 to 3 days. Deliveries are booked up for 2 to 3 days. They urge people who can to place click and collect orders further afield and ask family or friends to collect those orders and drop them to their doors. I understand Uber Eats have partnered with IGA to provide an additional delivery option. Anyone who needs urgent help should contact 134 COVID. Our supermarkets have also asked if we could remind people in the lockdown areas that are going out to the supermarket for essential supplies to do so alone if possible. Pick a member of the household to go and do the groceries. Don't all go together. That will assist our supermarkets in maintaining their social distancing. The Chief Health Officer is very keen to see extra testing in the Cairns community. You'll recall we had a case there the other day, reported a case there the other day, but we need more tests to be assured and reassured that there isn't transmission that we're unaware of. I'm pleased to report the Premier's had her final COVID test of home quarantine. It's come back negative, so she's looking forward to being released tomorrow morning. She's going to come straight to work, and she's looking forward to being here with us for the press conference tomorrow. So Queensland, this is another very good day. Very, very encouraging results. You're doing great with your wearing masks, with your getting tested, with your staying home. We need to keep it up. And if we do, that's what will give us the best possible chance of starting to get closer to what is normal as soon as possible.
Thank you, Deputy Premier. So 13 new cases overnight, all locally acquired, all in quarantine. One of the 13 I'm just checking with, as we haven't been able to get the details about whether or not that child was out and about while infectious, but they were in quarantine when the test was done. So I'm pretty confident that all 13 were probably in quarantine for their full infectious period. I just need to get that last bit of information, and we'll put that out in a press release this afternoon. But that is encouraging. It really is. We now have over 10,000 people in home quarantine, and I thank every single one of those people for persisting. This is going to be a lengthy time for some of those people, because as each person in the household becomes positive, quarantine then extends for another 14 days from that point going forwards. So there's a lot of work for those households, and that a support line is available if they need any assistance with getting any groceries or any essentials. But it is absolutely critical that no one from any of those households goes out into the community. So I'm very grateful to those people. We've now got another 2 days, today until 4 p.m. tomorrow, to continue to see how we go. So it's important to continue that testing. That's very important, so that we make sure there aren't any unknown cases out there, because this outbreak has only been going for a short period, so there could still be cases there. So very important to keep the testing going. Very, very important to keep wearing masks. That's critical as we go forward. And for people to just stay home. It was encouraging to see there were very few people on the road this morning when I came into the city. So please just enjoy the last 2 days of the Olympics, watching them at home, and encourage our athletes. They've done so brilliantly, and I know we'll do brilliantly here in Queensland to combat this outbreak. So all of this is really important. And please, Cairns, you've already done a great job coming out and getting tested since you heard about that reef pilot being positive. I need you to continue that for a few more days. We just need to check what's going on in Cairns. So anyone in Cairns today with any symptoms at all, please come forward and get tested. We've got 7 of our public clinics open, ready to test you today. That's important. And congratulations to Rockhampton. They've done all of their day 5 testing of all of those close contacts, and they're all negative. So still important in Rockhampton. Anyone with any symptoms, come forward and get testing, but that's looking a lot more reassuring what's happened in Rockhampton. Thank you.
Great work, Queensland. Keep staying at home. Go get tested if you're unwell, and get vaccinated. Yesterday we recorded a second day in a row of the second highest vaccination rates across the country. So I want to thank all of our clinics that are doing vaccinations, our GPs, and of course our pharmacies came online yesterday. And I've had plenty of vaccinations over the years, and none like this. The relief I feel knowing I have that added protection against COVID is a feeling that I think every Queenslander should have. And so we want you to go out and get vaccinated as soon as possible. And with more pharmacies coming online next week, when extra doses arrive from the Commonwealth, more people are going to be able to get vaccinated quicker. So please take up that opportunity. Testing, don't wait longer when you are unwell. Every day that you are in the community is an extra day that you could be infected and spreading it to others, and an extra day of delay in finding other close contacts. So if you wake up feeling unwell, don't wait, go get tested. But we do want to thank everyone, particularly our health workers, the great work they're doing, our frontline workers, the retail workers who are keeping our supermarkets going. We thank all of them. And of course those people staying at home under home quarantine orders. We really do appreciate it. Now I am aware of a couple of incidents, and I'm sure the police will speak to this as well, where people are coming from down south still trying to get into Queensland. This puts everyone at risk. We had an incident yesterday where 2 paramedics are now in isolation awaiting for the results of these people who came up from New South Wales. It is unacceptable that people are still trying to get across our borders. It not just puts our frontline workers, our police, our paramedics at risk, it puts suburbs like the Gold Coast and the whole of Queensland at risk because they are on the front line of that border. So our message to everyone down south, you are coming from a hotspot. The police are monitoring. We don't want you to be visiting Queensland right now. When our borders are open, we want to welcome you with open arms, but now is not the right time.
So over the past few days, we've increased our operational presence across the lockdown area. Yesterday we intercepted over 10,000 vehicles That included 5,327 at our interception points in the lockdown areas. I'm very pleased to say that on each of those days, that the levels of compliance has continued to improve in our community, and we thank you for that. But to that small group of people that persistently do the wrong thing, the 42 persons that we had to give penalty infringement notices to in vehicles that were intercepted, people that did not have a valid excuse for being out and about in the community, and the 16 people we had to give penalty infringement notices to who refused to wear masks, of the 175 persons that were offered masks by police officers and given masks, to those people, do the right thing. Stop that behaviour. Because what's going to happen is that we're going to continue our operation until the lockdown ceases. Once it does eventually cease and we see the restrictions, we'll continue to make sure that those restrictions are abided by as well. Because this is about stopping the spread of this very dangerous virus. Let's not forget that. We do not want to hand out fines to people. We only do that to people who simply will not do the right thing. Unfortunately, we also saw 4 arrests yesterday. We had 2 persons at Noosaville who not only refused to check in with the check-in app, then refused to wear masks, and then decided to have an argument with police and resist arrest. So that kind of behaviour is just not going to be tolerated. The other thing you run the risk too for the people that don't want to do the right thing is our community is telling us. So we had 96 calls for service yesterday, and that includes outside the lockdown area. We were given a tip-off around 2 persons in Mackay who had left Brisbane simply to attend a party, knowing full well that they should not be outside the lockdown area. Both of those persons have received a $1,378 fine for their trouble. I'm pleased to say that 312 businesses were inspected yesterday and not one breached, so thank you to all of the commercial enterprises out there that are doing the right thing. I'll just finish by commenting on what the Health Minister said around the border breaches. Our road borders are still in place. Do not come into Queensland unless you have the exemption, and when you do, follow the requirements, have the right border pass, and everything will go as it should. For those people that do the wrong thing, even if we find out retrospectively, we will investigate it, and it carries severe penalties of $4,135 for every border breach. Thank you.
On that case, I understand that they refused to leave that house, or was it 4 people? What did you have to do, or your officers have to do?
Look, we worked through that with Queensland Health, obviously, because directions are given. There are a couple of instances that we're looking at, separate ones, that involve border breaches and people that are involved. So we'll work through that. At the end of the day, there is no risk to the community. We have these people in place. We will get them into the appropriate quarantine in due course.
What action will be taken against
those
4 people, so 2 adults and 2?
The matters are under investigation, so we'll see what the evidence tells us, and then we'll take the appropriate action. Thank you. We're still investigating that. No, the best thing I can say to that young lady is please give yourself up, because we're not stopping until we find you.
What's stopping you at the moment being able to locate her? You have a name, you have a phone number, you've been in contact with her. What's stopping you?
She does not want to be caught. Unfortunately, in policing, we deal with these fugitive-type situations a lot. Sometimes we get them quickly, and sometimes it takes longer, but generally we find them. Thank you.
Minister, with this growing concern around the New South Wales border, is there anything further Queensland can do, or anything you're looking at changing around that situation?
No, look, the police are doing a fantastic job, and the message is if you turn up at the border without the proper exemptions, you will end up in hotel quarantine. There is no point getting in your car trying to come into Queensland if you don't have the right border pass, because you will end up in hotel quarantine.
Is there another issue with the vaccination hub at Ipswich that was closed down because it was an exposure site? We're hearing that closed again today.
My understanding is Ipswich is open today as a testing clinic.
What's the likelihood of Brisbane's lockdown being extended by 2 and 3 days to make sure that we're on top of it?
It just depends on what the numbers are tomorrow morning. So today's numbers are encouraging, but I really can't predict what tomorrow will do. I need those numbers before we have a decision.
Without playing the hypothetical of when lockdown will come out, are there any indication as to what the restriction easing might be so that businesses can at least plan ahead for when they eventually are out, so they can kind of get their ducks in a row to make money back quickly?
They should go and look at what we've done in the past. It's most likely that's what we'll do again.
Should
As I said yesterday, our public sector managers are making sure that their workforce can access flexible working arrangements to be able to get their vaccines. That's not unusual in public sector workplaces.
Deputy Premier, we've seen some more detail about the proposed facility at Inala. The report done by consultants show that only a third of these beds would be open best case scenario by March 31. Is that quick enough?
Well, we've been calling for dedicated quarantine facilities, I think, since December. We've had proposals on the table, I think, since January or February. So we want to get a facility like this up and running as soon as we possibly can. We've seen the weaknesses of hotel quarantine. We want a dedicated facility with dedicated infection control where we can safely keep returning Australians and other travellers without exposing our communities to the kinds of risks that we know now exist in hotel quarantine.
So what's the state doing to expedite that process, and when will that MOU be signed?
So we're working as quickly as we can to give the Commonwealth the information that they need to build the facility at the location they have chosen.
In New South Wales, they're understandably questioning whether they can realistically get to zero cases. Does our benchmark for opening the border change in that instant? Does it become a vaccination rate as opposed to a number of cases at all, or do they have to get to zero?
I think
I know that's a health question, but
it is, and at the moment we're focused on tomorrow, not necessarily what might be the case in a few months' time. If we do ease our restrictions here in coming days, well, the border then becomes much more important because the ability to stay open is reliant on our ability to contain the virus to south of the New South Wales border.
Some smaller border communities in regional Queensland are reporting difficulties with the cost of keeping that border closed. Will there be any financial support forthcoming for those smaller towns that are being impacted by those limitations?
So we've been in constant communication with the leaders of those communities to make sure that the border, the implementation of the border closure is as smooth as is possible. They very often have people who move readily across the border for their day-to-day work and school and access to groceries, that kind of thing. And so we've been working with them to make that as smooth as possible. In some cases, those communities have put in things like boom gates and dedicated facilities, and where they work with police and are directed to do that, then we'll discuss with them how we can assist them with those costs. But we have also delivered to those councils much more in terms of COVID stimulus payments than they have incurred in the costs of the border closure implementation, often in the order of 10 times more. So we are doing what we can to support those communities. Was that to me? Or?
Sorry.
Healthness. Very good.
Apologies. I just have a quick question just on the Coles and online shopping in that regard. We've heard cases of people still waiting up to 5 days for groceries. Can you just get a clear and concise message that is someone able, because I know someone personally who is stuck in quarantine, all their close personal friends are within quarantine, so they can't drop anything to each other. Is someone able to travel, say, from 25 kilometres away to deliver food outside of the 10Ks if it is for care in that regard? And they have no other.
Look, I'll get Dr Young to specifically comment on that. We have the 134 COVID number as well. If anyone needs any assistance and they're unable to have friends or family or neighbours assist them, and they're not able to get the direct delivery because of delays with the supermarkets, we certainly want to make sure people are getting any assistance they can. So we do want them ringing the 134 COVID number so that we can assist. But just in relation to the 10 kilometres, I'll just get Dr Young to comment.
I would prefer, if they've exhausted all their local friends and family, to just ring 134 COVID, and that will be sorted through that process.
you know what the wait times on that particular hotline are at the moment in terms of when those issues will be addressed?
Pretty quick. So they've got a lot of resources. Department of Communities has put a lot of responses in place, so there won't be an issue there. But I would prefer that we don't have 10,000 households ringing 134 COVID, but those people who, as it sounds like your friend is probably in that group, that really just don't have anyone that can assist them.
Dr. Young, we know there's a police investigation, but just with the woman who remains outstanding on the Gold Coast, how concerned are you about a potential outbreak?
Of course it's a concern, but I understand she's already tested negative once and police will find her and then we'll be able to test her again and that will definitively say whether there's been any risk. But that's why people in the Gold Coast, thank you for raising it actually, it's a very important question. People who live along that border zone, it's really even more important that if they have any symptoms at all that they come forward and get tested, because although police are doing absolutely first-class job at managing that border, we know people can slip through. So anyone who lives in that Gold Coast, but any of those LGAs along our border, it's really important that they come forward and get tested.
Under Windy's reporting some pretty good vaccination numbers this morning.
Yes.
Is there anything differently logistically happening there, or is it just the turnout?
Oh no, and what we've done with our smaller communities is we've just gone in quite early and done the whole town. So rather than separating into those different age categories, we've gone in because it's much easier to just go in that once. So yes, that's what we've seen in a lot of those smaller communities.
And just quickly, one more for you, if you don't mind. That case on the Gold Coast yesterday with that family holding up in that house, do you have to give some sort of order yesterday for police to be able to go in there and remove it then? Or
No, the police have the capability to do that.
Straight into quarantine.
Deputy Commissioner, can I get one more? We've received a few calls this morning about the powerhouse market and the lack of social distancing, masks, and apparently a few calls to police. Are you aware of anything going on?
No, I haven't been specifically briefed on that at this stage, but obviously the message is for everyone that we're still under the restrictions. You have to follow what the guidelines are, and if anyone's doing the wrong thing, our police will be there to sort that out. And as always, you're given the opportunity to do the right thing and comply with the directions. When the police intersect with you and ask you to do the right thing, please follow those guidance. Otherwise, there's penalties that can come. Thank you.
I know a lot of people wanting to keep their weekends still feeling like a weekend. Will you be upping the patrols on, say, the beaches and popular areas like that?
Yeah, well, look, we've learnt now that there are certain public spaces, and beaches are one of them, where people sometimes do the wrong thing, so we'll be making sure that they're covered. As you've heard from the figures this morning, we're increasing every day our presence out there to make sure we get right to the finish line with this in good shape. Thank you.
Thank you. Thank you.